You are watching the DOCTALK show.
Welcome back. The fight against HIV is never an easy journey, as everyone who is engaged in taking care of an HIV patient will tell you, whether it's a health worker or a leader or anyone involved in managing a disease will tell you that there are always challenges faced along the way. So in as much as you see lots of progress the government has undertaken in reducing the number of HIV infections in the country, it has never been an easy state. And we want to understand which are the specific challenges that they are facing. So maybe Dr. Byamukama, would you tell us more, as a country, are there specific problems of why we can't completely remove HIV?
Yeah, thank you. There are quite several challenges which we must work on if really we are going to hit our target of ending AIDS as a public health threat by 2030. The challenges which are stopping us from ending AIDS now. And there are various, really, there are several. Dr. Msing's already hinted on some. I would start with condoms. Right now in the country, we have so many condoms in stores, in the national medical stores, at the DHO's office, and the people are not using the condoms. So there is low condom use. The people, we have talked to the people, to Ugandans. The Ugandans of the 1990s were saved by condoms. People used condoms, and that's why we had the generation that managed not to catch HIV, to develop HIV. Because HIV in 1990 would kill, but a few who used condoms did not develop HIV. But we noticed there is complacency. Our stores are full of condoms. People are not using condoms as they should be, they ought to be. Yet when we look at other indicators that show that actually people should be using these condoms, I can give you like behavior. The behavior of the people keeps on not getting better. Like in terms of risky behavior, concurrent sexual partnerships. We are seeing a trend that as we become a richer nation, the number of men and women who have an extra boyfriend keeps increasing. It's not getting less. For us in the HIV response, we would want to see the number of people who need an extra boyfriend or girlfriend becoming less and less. But instead, we see the behavior of the people are getting complacent, the number of people who have multiple sexual partnerships, they are going up. We talked about the sexual network is increasing, it's there. We talked about issues of stigma. At the start of the HIV response, I think that mistakes were made, mistakes which stemmed out of ignorance. We didn't know what HIV was about. And I think the messages we used at the time are sparked of stigma. HIV became a shameful disease. So that stigma has stayed. It is stopping people, especially the men we are talking about, from coming for treatment. Even those who have given treatment. We believe the number of people who are not yet tested, not yet on treatment, a significant number is because of stigma. Self-stigma, but of course they have learned it from society. So we would want, as a country, in the Presidential Fast Track Initiative, we had made a commitment that come 2020, stigma becomes an issue of the past. But there are still some prevalent levels of stigma which are interfering with our efforts to get everybody tested, get the drugs they need, live vibrant and healthy. So we would want as a country, in line with the theme of the World AIDS Day now, in solidarity, to make stigma an issue of the past. Stigma interferes with our HIV prevention efforts. It interferes with the health of the people who are living with HIV. They will not adhere to their drugs very well. There are other issues I would want to highlight. Gender. Issues of gender-based violence. There are several women now who are scared of testing for HIV or disclosing their HIV status to their partner. Because if you have not disclosed your HIV status to your partner, most likely they will take your medication only when he's not there. Because they are scared, their partner is going to abuse them, is going to beat them. So there's so much gender-based violence that puts many women at a disadvantage, number one, to acquire HIV, to be at risk of acquiring HIV. I have had a chance of talking to young little girls who are in the sex work business. When I talk to them and I ask them, why at a young age are you on the streets selling sex? Almost all of them, their stories were the same. they ran away from some form of violence from home. Sexual violence, mainly, brought upon them by a relative or somebody they trusted, and they ran to nowhere, and once they reached the city, they ended up in sex work. They were stuck, they had to find. So we want to fight gender-based violence, especially guidance against girls and women. It is still drawing us, our efforts back. We are still seeing, there are gaps, of course, in service delivery, which Dr. Msinguz would be in a better position to highlight. We cannot claim that we have brought the service closer and to the most convenient place. Every person would want to access them. But as a country, maybe I should have said it among the achievements, we are proud that we have brought the services really as close. We have spread them out across the country. They're accessible at least in most health center 3s, health center 4s, and even some health center 2s. So we are comfortable that if we had to score ourselves, we would score ourselves fairly, that services will brought them closer to the people, but we still admit that there are challenges in access to these services. And the services like circumcision, we would expect all men to be circumcised. But we see some cultures, the Bachiga, the Banyankole, the Acholi, the Ranji, they're still fearing to circumcise. Circumcision would want all men circumcised if really we are serious about ending AIDS as a public health by 2030. Maybe I will leave my colleague Dr. Msinguz to add on a few challenges that I may not have brought out.
But I want to ask about the financing of the AIDS fight against, not the pandemic, fighting the pandemic. How much has the government put in terms of financing, or is it a case that we have to wait for donors to give us money?
Thank you, Darius, and I thank you, Dan. I think the issues around the challenges and the unfinished business. The other thing that we don't want to forget is the impact of COVID. As you know, the world is dealing with a global pandemic now. It's a big, big problem now. The numbers have been going up across the globe, and people have been dying. In Uganda now, close to 18,000 plus infections, over 190 deaths. Those are big numbers. People are dying. The country has taken strong measures to address COVID, as you know, right from the times of the early March. And the President, the Minister of Health, the leadership of the Minister of Health, Permanent Secretary and Director General came up with guidelines that we disseminated to the country to ensure that we educate the public about COVID, to make sure that these services remain, our services remain available.
And this includes HIV?
Including HIV, including tuberculosis, including our maternal and reproductive health programs, malaria, and so on and so forth. And we disseminated those guidelines across the country. And because of those, for example, for HIV, we have been able to maintain and recover some of those early declines that we saw in testing, in circumcision, in ART. We also had to come up with very innovative approaches. For example, we had to ensure that we have community security, because there was a threat at that time that it was going to be possible for the supply chain to be interrupted because of the global lockdown. So we had to order our requirements in time, and that helped us to make sure we didn't have any stockouts. We also had to do approaches, for example, for multi-month dispensing of our ARVs, to make sure that when individuals came, especially those that are stable in treatment, we gave them long duration refills. Somebody could go with their refills for 3 months, for 6 months, depending on the availability of stocks in those facilities. We also came up with the mechanisms of working with the PLHIV networks and our community systems to access drugs and take drugs up to the people in their communities and sometimes up to their homes.
Okay.
And we also, I think also I remember we also had to come up with ways of migrating patients from their primary health care, their primary ART points to those that are nearest to them. Some individuals come from as far as Kavari to access drugs in Mulago, to access drugs in Kirudu. We told them you could go back to your nearest health center and that worked very well. So COVID has been a problem, it is still a problem, but we have got ways around it to try and make sure that we continue to focus and provide treatments.
Okay.
The thing that we want to appeal to the public is utilize these services. The services are there. The services for testing are there. Now, in the case of men, we have had to come up to start going to where they work from. For the border people, for example, for those that work in some of these building sites, for some that work in those construction places. Financing, finally, I think you asked about financing. Financing has remained a challenge. We still have funding gaps, and I think Dan can talk to that. But I want to appreciate the development partners and the government of Uganda. The government of Uganda have upped our contribution for treatment and for other commodities, but also for our other activities to run the programs. The budget has incrementally been going up over time. I think now the government of Uganda is putting 150 billion shillings has put 150 billion shillings into the budget for ARVs and for other commodities for HIV. As I indicated earlier, the US government through PEPFAR are putting in about 500 million through the COP, the Country Operation Plan 20. And that is being utilized by the implementing partners across the country, but also the national level above site partners. The Global Fund, which is supporting us in the area of HIV, TB, and malaria. Almost $600 million for all those three diseases, but about 300 million for HIV for 3 years, 2021, 2022, 2023. Okay. And that's in addition to the 270 million for HIV that the Global Fund has invested in the country over the last 3 years. So a lot of support, but also other UN partners, the World Health Organization, UNAIDS, UNDP, UN Women, UNICEF, UNFPA. We want to thank them very much because they have moved in. The Ireland aid support that has been coming through the Uganda AIDS Commission, and also support from the World Bank and the DFID and other multilateral partners has really buttressed our response. And I think we must appreciate them and appreciate all those stakeholders and the AIDS development partners and implementing partners who are playing their due roles in implementing this response.
Very much appreciated. The stakeholders and the partners involved in helping the country overcome the epidemic of HIV. So as we go into a short break, we'll come back and talk more about what the future holds for Uganda. We've now understood where we are as a country. A lot of money has been put into fighting HIV. We have different people working together to reducing the burden of HIV. So I want to know what the future is like. How are we going to address the gaps that have been mentioned? What work has to be done to ensure that the epidemic is kicked out of the country? Back after the break. Please stay tuned.
You are watching the DOCTALK Show.